joining with us. On behalf of Nash 24 by 7, I welcome you all in today's live Facebook program. On the occasion of International Nash Day, today we are going to have an interactive session on menace of fatty liver and its consequences. Today we have with us renowned gastroenterologist Dr. Vibhor, who has over 2 decades of experience in the field of gastroenterology. He is currently a consultant gastroenterology at Max Hospital, Gurgaon, and has chaired and sessioned in several national and international conferences and has numerous publications on his name. So on this note, I would like to hand over the session to Dr. Vibhor.
Hello, good afternoon everyone. I am Dr. Vibhor Pareek. I am gastroenterologist at Max Gurgaon Hospital. So today our session is on NASH. The full form is non-alcoholic steatohepatitis. So steato means fat. So this disease develops when there is more than usual amount of fat in deposition in the liver. So liver cells in normal conditions, in normal circumstances, they do not have fat in them or very little fat. So conditions in which fat gets deposited into the liver cells and hampers its normal functioning can cause to liver disease. So NASH is a form of one of the liver diseases, which starts by accumulating fats in the liver cell. There are many other circumstances, diseases, which can lead to this condition, like obesity, overweight, diabetes, dyslipidemia, hypertension, hypothyroidism, any metabolic disorder can lead to deposition of excess fat in the liver. People who follow sedentary lifestyle, there is no proper regime of exercises, there is no proper regime of food intake, there is no proper menu that means good amount of protein, less amount of carbohydrates, less amount of fat, junk food habits, more calories intake in the form of either fat or alcohol can also lead to the fat deposition in the liver cells. So this is a very silent disease. You in day-to-day routine, you will not come to know that fat is getting deposited into the liver until you get the symptoms of abdominal discomfort. These are not primarily symptoms of NASH, but yes, people get symptoms of abdominal discomfort, fullness, tiredness, lethargic, early fatigue after working even for a few hours, less of energy levels. So after some time, when you go to a doctor and they advise you some blood test, you are also gaining weight simultaneously. So after seeing your blood test, the doctor can see, yes, there are raised liver functions and dyslipidemia also. So unless you get some symptoms, you will not able to know that you are getting into the NASH. So fat deposition in the liver will also cause the damage of the normal liver cells. Day-to-day habits of binge alcohol, junk foods, not doing proper exercises, not spending time outside in the sports arena can lead to this. People who are suffering from diabetes or dyslipidemia, yes, as I told, they are prone to this condition. But if they are going to manage their diabetes well by taking proper medications, for cholesterol or triglycerides, whatever is there in the blood test, yes, will help the liver in recovering soon. NASH can progress to more severe form of the liver disease. It can cause liver cirrhosis. That is scarring of liver cells. That is an irreversible damage to the liver cell. Liver cirrhosis per se have more serious symptoms like ascites, pedilledema, low albumin in the body, and more complications like esophageal varices, upper GI bleed, melanic stools, hepatic encephalopathy. These are all later consequences of liver cirrhosis. So everything comes to what? The fat deposition in the liver. How can we prevent it? We can prevent it very easily by knowing your normal daily regime, knowing your daily calorie intake and calorie burning. You will come to know that how much fat, how much carbohydrates, how much kilocalories you need to take in a day so that the balance is maintained, so that no excessive remained calories goes inside into the liver cells or in the blood vessels like cholesterol or raised cholesterol or triglycerides level. So by doing this, you can prevent fat deposition by knowing your proper diet. Again, very important factor is to know the family heredity of diabetes, dyslipidemia, because many times it runs into the family. Parents are obese, kids are obese, nobody have this habit or practice of doing proper physical activity exercises. Everybody came to know that when they are diabetic or when they have uh, dyslipidemia in their blood, only after that people wake up, okay, I am having these problems, I should go to a doctor and start medication. So if your parents are prone to diabetes or dyslipidemia, you can early detect or you can take precautions that you should not end into the same line of diabetes or dyslipidemia. So this will also help. Now, everybody in these days want to have parties, can want to have spend good time with the friends and family. So again, alcohol is another thing. Alcohol contains good amount of calorie in each 30-60 ml pack as per the calculations. Person who make balance, who continue to have balance between the diet intake and the calorie burning, they are less prone to that the fat will deposit into the liver. That calorie burning will help them into burning that excessive fat so that it does not go into the liver cell. So it's very basic science. What you are doing, what calories you are burning, you should take the amount of calorie intake should be appropriate to that. It will reduce the excessive burden to the liver. It will reduce
Yes, sir, you can continue.
Yes, I'm so sorry. There was a phone call from my ICU team. So a doctor may only diagnose NASH after many years, as I said, after the patient's having symptoms or blood reports are showing changes.
Sir, you're on mute.
Hello.
Yes, sir. You're audible, sir.
I'm extremely sorry.
It's okay, sir. Yeah.
So we were talking about the NASH, that is non-alcoholic steatohepatitis. In layman's language or in general language, it's a fatty liver, which usually when we go for even for a routine ultrasound, the sonologist will tell, okay, your liver is bright in nature, what we can see on the ultrasound. So that is fatty liver. They put it as a grade 1, grade 2. So grade is how your liver looks like in the ultrasound, depends upon the grade, but that's not the important thing. The important thing is to diagnose why you are getting that extra fat into the liver, because in normal circumstances, it should not be there. So as I told you, you should know your genetic lineup, mother, father, diabetic. You should know your daily routine, exercise. You should know your daily consumption of calories as well as calorie burning. The balance should be between them. I want everybody to lead a good, happy lifestyle, not bother that, okay, I'm eating this much, what will be the percentage of fat getting deposited in my body. No need for those calculations. You just need to know how much physical activity you are doing daily and what are the calorie counts, intake and burning. So people getting diabetes, they will be more helped by when they will get the control of diabetes will be there. People who are having dyslipidemia, they will be benefited if they will take medication which will lower their lipid level, triglyceride like Belipsa. People who are diabetic as well as dyslipidemic, they are more prone to that non-alcoholic steatohepatitis can turn into the liver cirrhosis, that is an advanced liver disease. Why? Because there is not only the fat deposition is the issue, comorbidities like diabetes and dyslipidemia will also, it's a metabolic disorder, it will also contribute to worsening of the liver function test as well as NASH turning into the liver cirrhosis. So there are healthy ways to do it to prevent this condition. There are medical ways to prevent this condition. So my advice to everyone will be, get early diagnosis. Initially yourself, by checking your weight, by checking your calorie intake. And if you have been diagnosed as a fatty liver, a sonologist will tell you, yes, there is a fatty liver. You will feel lethargic. You will get those symptoms which we discussed earlier, like lethargic, gaining of weight. Then you should see to a gastroenterologist and a hepatologist so that a proper line of treatment can be decided. Not every time everybody is subjected to take medications only. Sometimes these conditions can be resolved by knowing the daily regime, by maintaining the daily regime of food intake as well as exercise. So for Ayushman liver, I would like that we should get an early call. We should get into our senses and think regarding our habits, regime, so that we can avoid an excessive fat deposition into our liver and we can avoid the situation of NASH turning into advanced liver disease. So stay healthy, stay happy by doing normal physical routine exercises and know your diet so that your liver stays healthy.
Thank you so much, sir, for such a lucid talk. And I'm getting some questions, sir. So I'll take it up one by one. So the first question is vitamin E? Is vitamin E good for liver? I am taking the same for last 6 months.
Yes, there are studies where vitamin E is very useful for in fatty liver per se. It helps in regeneration of the liver cells. But for taking it so long, for 6 months, I don't know what is the cause for taking it just for 6 months. Maybe I don't know who has asked this question. I don't know the medical history of that person. But if you have significant liver issues, then maybe your doctor has advised it. But if you don't have any significant medical issues, you have fatty liver in the ultrasound and a little bit deranged liver function test, then I think it's better to, as I said, know your daily regime, exercises by which you can reduce the amount of fat in your liver rather than taking a prolonged medication. That's why it's important to see to a gastroenterologist and hepatologist who not only prescribe the medication, but they will help you in knowing your diet better. they will help you in setting your regime better, so that you will be no need for taking medications for an extra long time. So I can't answer this that the 6 months a person is taking medication, vitamin E from past 6 months, how far or how this vitamin E, prolonged therapy of vitamin E will help him.
All right. So next question is, I am diabetic. Does changing oil and food habit matters in the case of fatty liver, and which oil is good for liver?
Oil is oil, तेल है, चाहे आप आजकल का फैशन आ गया ऑलिव ऑयल यूज करने का, पहले के लोग घी यूज करते थे, सरसों का तेल यूज करते थे. I don't think there is any big difference in the changing your oil from a sunflower oil to a olive oil. No. Yes, but जो आपने दूसरी बात बोली, diet, that's very important. So again, it comes to the calorie counts, and it's very easy. You eat daily food. आजकल everybody is so active on internet, so you can easily count your daily calorie counts. You have a bowl of dalia or 2 chapatis, so you can count how much calorie does a chapati contains, or 100 gram of dalia contain, or a glass of milk contain. And everybody is using phone or smartwatches. They can tell the steps taken daily. They can tell the calorie burn daily. So by doing this calculation, you will be benefited more than changing your oil. Control of diabetes is, again, as I said earlier, that it's very, very important to control your diabetes as well as dyslipidemia. Diabetic patients, dyslipidemic patients should take proper medications which simultaneously can control their diabetes level, deranged sugar functions, and high triglycerides. Saroglitazar is one of the form of the medication which is known as Bilipsa, that helps in maintaining the diabetes level, HbA1c levels, as well as reducing the level of dyslipidemia in the blood.
Right. So next question is fatty liver life-threatening?
No, fatty liver is not life-threatening. But as I said, the symptoms, you will not get a warning from the liver side. Okay, I'm now turning into an advanced liver disease or liver cirrhosis. No. So non-alcoholic fatty liver disease is just that deposit. Fatty liver is what? Deposition of fat in the liver. As well as your liver is tolerating that fat, you will feel all right. But when the symptoms arises of, as I said, lethargic or abdomen discomfort or yellow discoloration of eye, that means that fat had damaged significantly the liver cells and they are not functioning properly. So you will see the changes in your blood reports as well as ultrasound. So fatty liver is not per se is not a life-threatening, but yes, if you will miss that and you will continue with this continue to spend few years with that fatty liver with you, then that the scenario changes from just fatty liver to NASH and to liver disease.
Right. So next question is, my age is 52. I have grade 3 fatty liver. How dangerous it is? Please advise.
Again, as I said, it's grade 1, grade 2, grade 3. It's an ultrasound-based diagnosis. So for this 52-year-old person, it will be better to get into he should undergo liver function test as well as lipid profile and as well as fibroscan of liver. Grade 3 fatty liver at the age of 52, I think maybe he or she having some comorbidities like diabetes or hypothyroidism or dyslipidemia. Then it's very important to look into your blood reports of liver functions, undergo lipid profile and fibroscan of liver. So that and accurate assessment of severity at this stage, at this level, how severe is this grade 3 fatty liver, we can only predict after doing the battery of these tests like lipid profile, LFT and fibroscan of liver.
Right. So next question is, I was diagnosed with fatty liver last year. My CAP reduced from 350, CAP score reduced from 350 to 190. My LSM value is 7.3 kPa. I am taking vitamin E and Ursobiac. My weight reduced by 15 kg, but unconjugated bilirubin is high. Total bilirubin is 9. How long should I continue to take the medication?
So total bilirubin is 9, from which
Yes.
unconjugated is how much?
Sorry, sir?
Unconjugated bilirubin
is also high. Value is not mentioned.
Value is not mentioned. And the person had reduced 15 kgs of weight.
Yes, 15 kgs of weight.
And the value in FibroScan has also come down from
7.3 kPa is the LSM value.
7.3 is okay.
And cap is 350 to 190. Reduced from 350 to 190.
No, that's a good change. That's a good change from 350 to 190. Cap is not, I'm not bothered about cap. Yes, maybe vitamin E could be, they can continue vitamin E, but I just know the bilirubin levels. उसके अंदर भी conjugated का पूरा पता नहीं है. AST, SGOT, SGPT.
Unconjugated is 3.
Okay. So now OTPT levels will be important. OTPT levels are, if they are within normal range, that means there is no damage of hepatocytes, that liver cells. That means the way you are treating, the way you are going is a good, because you have reduced weight. You can see the difference between 15 kgs less or 15 kg more body weight in the FibroScan. The values are changed, the values are different. So that I think the person is going to a right direction. So they can continue for at least 2-3 months more and then repeat and evaluate himself.
Right. So the next question is, how do I strengthen my liver?
Strengthen your liver. Okay, fine. So as any other organ in our body, good diet, balanced diet, protein, fat, carbohydrates, everything should be in a balance. You should know your BMI, body mass index. If you are an average Indian, thin build, not very fatty, or you are not overweight, then you can easily calculate your daily diet, the protein, carbohydrate, and fat in your body. So by doing this, you will be, if you take normal routine diet, which is good for anybody, if you are not ailing from any other diseases like diabetes, hypothyroidism, dyslipidemia, or hypertension, you can manage your healthy liver by taking normal, balanced routine diet. There is no special elixir for it. So that if you will take some vitamins, your liver will function well. You should know that alcohol and unnecessary medications, they damages liver more than any other else. So by taking a normal routine diet, balanced diet, your liver can stay healthy.
Right. So with this, sir, we are done with our questions. And thank you so much, sir, for addressing all the possible queries and for such a wonderful talk on fatty liver. I'm sure after this session would be very helpful for all those fatty liver patients and their caregivers as well. And I would like to thank all our participants as well for their active participation. To stay updated more on liver health, NAFLD and NASH, do like and follow our page NASH 24/7. Thank you so much, sir, once again. Thank you.
So much, everyone, for being here. I'm happy, and I will be more than happy if the people who heard me, they can self-diagnose themselves, because it's very easy, few steps. And if they face any issue, they should see to a gastroenterologist and hepatologist. Thank you for bearing the glitches in between, few phone calls, this stuff. Thank you very much.
Thank you, sir.